Hi guys, how are we? I hope you're good. I'd just like to present to you guys today a presentation about the health systems in Papua New Guinea. In particular, how they were and how they are now, and the issues that people in Papua New Guinea face in terms of the health system and how they can achieve change in the health system. So in 1987, there was a steady increase of evidence of care in rural and country hospitals, which showed a lot of deficits in these hospitals. The issues that they faced are easy to be amended, and they just need commitment, steady commitment by government authorities, but not only government authorities, but by health professionals as well. Over the years, there was a study into the health industry in Papua New Guinea, and this was conducted by a nationwide study with 26 focus groups. These groups saw, as they were studying, they saw many issues, particularly in terms of commitment. So a lot of people, what they were finding was a lot of people were committing to certain parts of the project, but they weren't committing to the full thing. And when things got tough, they actually backed away from the project. This caused the changes to the health sector being really slow, and to the current point now, there's not much that has really changed, and there's still a lot of work that needs to be done. Over time, there's seen a large number of staff absences where staff, particularly in the health sector, just are not turning up to work. There's not much that's going on in terms of the provision of services. There's actually a very big lack of commitment by staff and by the government authorities over the years. There's been poor treatment and just lack of equipment, proper equipment, and the health sectors and hospitals that they have had have been very unsatisfactory and unstationary. So they haven't been able to perform a lot of medical emergencies or a lot of proper treatments that the people need, because they just haven't had the space or they haven't had the staff to be able to perform these tasks. Or if they haven't had the space or they haven't had the staff, they also haven't had the equipment. Therefore, because they haven't had the equipment, they haven't been able to perform these tasks. There's been a large number of referrals and even a large number of deaths within the health sector. As you can imagine, this is not and has not been a very good health sector and industry within Papua New Guinea, especially in the rural and country areas of Papua New Guinea. As I said, there's been a massive lack of equipment, and immunizations is actually dependent on stock. So a lot of the immunizations that we have here in Australia, over in Papua New Guinea, they don't have that. They don't have immunizations as much as we do over here. we live in a very lucky country that we have a lot of immunizations where, as I mentioned before, because Papua New Guinea is dependent on stock, so are the immunizations. As I said before, medical emergencies are dependent on a clean and appropriate delivery area. So if there's one, in a lot of hospitals, there's only one delivering area for medical emergencies. And if that's full with a medical emergency and another medical emergency breaks out, unfortunately that second medical emergency, because they don't have the space to be able to perform that, often what would happen is that second medical emergency, there's no treatment that is available for that medical emergency. There's a lack of, as I said, there's a lack of space, but there's also a lack of equipment. So if they're halfway through a medical emergency, I can only imagine they could be halfway through a medical emergency and find out that there's no equipment or not valid equipment to be able to continue that medical emergency. So a lot of people would get very sick, and often they would die during these medical emergencies because of the lack of space and the lack of equipment that the hospitals had. So I've just got some stats of issues that are faced with the medical and health sector. So 37% of medical centres in rural and country areas are in desperate need of maintenance. 13% of medical centres are unsanitary. 36% of medical and health centres need running water inside year round. So 36% of health centres don't have access to running water inside. 31% have no night duty attendant or have a night duty attendant. So as you can imagine, when it comes to a hospital stay, there's actually in 31% of the hospitals within the country of Papua New Guinea have access to a staff member. And a lot of these hospitals or medical centres, when you go into them, you don't actually get seen by a doctor. You get seen by a nurse or a ward clerk, which is not adequate care. 40% of children clinics do not have a refrigerator. This is very poor conditions that Papua New Guinea health centres are faced with. However, over the time, and particularly now in 2018, we have seen a steady growth, a steady but slow growth and change in their health centres. There's been a lot more commitment happening, which is fantastic. The government has actually set out a plan to see the health centres completely changed by the year 2020. There's a great move within the government authorities to see change happen to the health centres and the people in Papua New Guinea. There's still a long way to go. As I said, there's a lot of maintenance that needs to be done. But I really believe that through steady commitment, not only by the government authorities, but by the health professionals, we can see the health centre in Papua New Guinea completely turned around for the better, and the people being completely changed and having adequate and sanitary care. Thank you.